A note before we start. This episode mentions suicide. From The Australian, here's What's on the Front. I'm Kristen Amiot. It's Wednesday, December 11. Anthony Albanese visited a Melbourne synagogue on Tuesday, 4 days after it was targeted in a terrorist attack.
This arson attack is an act of terrorism. It was fuelled by anti-Semitism and it was stoked by hatred. We're a country that needs to come together and unite.
The Prime Minister was swarmed by a group of worshippers and community members during the visit, with some of those in attendance heckling the PM as he made his way to his car following a tour. Foreign Minister Penny Wong and Treasurer Jim Chalmers both defended Anthony Albanese's response to the firebombing, saying he's very engaged on the matter. The Reserve Bank has kept interest rates on hold at 4.35% for the 9th straight meeting. That's despite pressure from the unions to deliver a rate cut before Christmas.
The truth is that some inflation pressures remain and cost of living pressures remain a burden on all Australians. It's also important to note that prices are not going back to where they were before this high inflation.
Those stories are live right now at theaustralian.com.au. Australia's mental health care system is in crisis, and one group is shockingly overrepresented in the figures. Today, health editor Natasha Robinson unpacks the ways the system is failing Aboriginal people when it comes to mental illness. Outback Australia. It's the stuff of legend, the domain of the world's oldest continuing culture, where vast plains give way to towering summits and deep valleys. In Australia's storied centre, there's red dirt as far as the eye can see. And it's there that the wheels of a light plane touch down, the roar of its engine cutting through the silence. On board that aircraft is a handful of medical professionals, psychiatrists, GPs and nurses. They've made these trips to some of the nation's most remote communities before, where they administer antipsychotic medication to large chunks of the population, with precious little time for counselling or consultation. They're called depot injections, where drugs are released slowly into the body over several weeks, when the physicians will return to do it again.
I would say that the situation in remote Australia is dire for people experiencing mental illness and indeed disability, especially in the Northern Territory.
Natasha Robinson is The Australian's health editor.
The situation there is that there is virtually no healthcare for people with complex, severe needs in these communities, and there's virtually no publicly funded outreach service either, which is quite an astonishing thing. Really, if you are in remote Australia, in the Northern Territory, unless you are admitted to hospital or you happen to be able to access some services in Alice Springs or Darwin, if you are on country, hundreds and hundreds of kilometres away experiencing severe mental illness or cognitive disability, there's very little healthcare available for you. So it is an extraordinary thing to imagine that this is the way we do healthcare in remote Australia. It really is a form of community control, effectively, because these communities have very little healthcare, not a lot of policing. They can be quite dangerous places if things get out of control when people's health is not looked after.
When she ran for office earlier this year, Northern Territory Chief Minister Leah Finocchiaro campaigned on a tough-on-crime platform.
We've been really clear that it's important to hold people accountable for the crimes they're committing, but to put them on a better path going forward. And that's why.
Since winning that landslide election in August, Finocchiaro's Country Liberal Party has pushed through a suite of changes under its Criminal Code Amendment Bill. That includes lowering the NT's age of criminal responsibility to 10 years, down from 12, and tougher bail legislation designed to keep young people on remand for longer.
Such as boot camps. This is important work that needs to be done, and there do need to be more diversion options for our courts. But importantly, it's not just about dealing with young people or offenders once they're already committing crimes. This is about making sure we give kids every opportunity in life to succeed, and that's why our focus...
Opponents of the reforms say the multi-year justice reform rollout plan will cost taxpayers hundreds of millions of dollars, and it's being viewed by healthcare providers with despair.
This is a disaster for some communities. It does land people in prison quite frequently, and the healthcare situation for them in prison is very bad as well. Absolutely scant services, especially in juvenile detention. The prison's approach to healthcare is one of control through chemical restraint, the use of physical restraints. It is not a healthcare setting for people with severe mental illness and disability. And we have had extraordinary access as part of our series, which we've called Cast Adrift, looking in depth over the course of an entire week nationwide at the mental health situation for people with severe needs. And we have a public sector psychiatrist, very senior psychiatrist, Marcus Tabart, on the record telling us that he personally has literally had to cobble together resources for youth and adolescent people in need across Central Australia because there is no public funding to provide this. He's just saying, look, we have people come in to Alice Springs Hospital where he works, but we are not resourced for in-reach to the prison or to the juvenile detention centres. We're not even resourced to provide any care outside of Alice Springs. That is an extraordinary situation for some of the most vulnerable people, really, in our society suffering mental illness. Of course, many of them do end up in juvenile detention centres, which are quite frankly hellholes.
Nyamal woman and psychologist Dr. Tracy Westerman runs a charitable organisation that helps healthcare professionals conduct mental health screenings in a clinically and culturally informed way. She's built a network of Aboriginal psychologists and is hoping to open the first national Indigenous psychology treatment centre. But her work has never been supported by government funding, relying instead on scholarships, donations and her own money.
Well, Dr. Tracy Westerman is an extraordinary professional based in Western Australia, and she is very passionate about establishing a national network of Aboriginal psychologists, and she's actually beginning to employ them through her own foundation and hoping to start the first national Indigenous psychology treatment centre because it's so critical that people receive culturally appropriate support, but support that is actually going to be effective. At the end of the day, people need to receive care from people that they relate to. I mean, that's the case for all of us.
Research conducted by the Westerman Jalea Institute for Indigenous Mental Health found a quarter of young Aboriginal people who presented to mental health services around the nation, just over 1,200 of them, had attempted suicide. For some, it was more than once, and almost half have thought about ending their own lives. The numbers are shocking and undeniable.
Dr. Westerman is trying to form this as a national network, but she's made comments to the effect that if you geo-map where the risk is in this country, she's talked about Alice Springs, she's talked about Cherbourg in Queensland, she's talked about Walgett in far western New South Wales. All of these places would be lighting up like what she describes as a Christmas tree because there is such severe need in these areas, yet they are the areas where there's almost a total lack in some senses of service provision.
Coming up, inside our groundbreaking analysis of the state of Australia's mental health care system. Natasha Robinson has been working for months on an in-depth review of Australia's mental health care system, alongside former Australian Medical Association President Professor Steve Robson and academics from the Australian National University. On Thursday, a policy report will lay bare the stunning $8 billion shortfall in services across the nation, including a lack of hospital beds and housing.
It is very clear that The severe end of the spectrum of mental illness is critically under-resourced. That is quite obvious when you look at the outcomes. What you have here is a cohort of people, 1 to 2% of the population, experiencing severe mental illnesses that represent, when you take mental illness as a whole, the second biggest burden of disease in the country. It's a very large burden on taxpayers, but it's an even larger burden on families and the sufferers of these mental illnesses, who by and large really have quite poor treatments available to them. And I think it's something that more than deserves to have a light and shone upon it. What else I have noticed as a health journalist over the past 5 years covering successive budgets, it just seemed to me year after year at the Commonwealth level, you have these quite enormous amounts of budget line items going to digital resources for people with mild to moderate mental illness, in fact, pretty mild level of acuity, an $850 million spend for a website for people with mild disorders was the biggest line item in mental health in the last budget. Now, I don't think that you can sensibly make an argument that the people who are accessing those services are going to be saved from this trajectory of sliding into a psychotic illness. It is not the way that it works. So we need to resource these very severe conditions. We need to actually put the money behind keeping people well. And since the era of deinstitutionalisation, that promise that there would be community resources, that people would have the care that they needed to live fulfilling and meaningful lives and to be well, as they all deserve to be, never materialised. And that is why this is still a story. That is why we look back over the past 3 decades and say, this is a comprehensive failure and there has to be a line in the sand.
Natasha Robinson is The Australian's health editor. You can read all her reporting on the state of Australia's mental health sector right now at theaustralian.com.au.